This is Dr. Ben Pearl with Fit for You. So today we're talking healthcare and some of the misconceptions about healthcare and how it actually works. So I've got Craig Thompson. He's been a Medicare advocacy patient. So you're going to tell me about what I like to deem Medicare disadvantage and some of the things that most people don't know about healthcare.
That's right. So Dr. Pearl, recently we found that the CEOs of the publicly traded health insurance companies were complaining on Wall Street conference calls that they're going to prioritize margins over members, which is code for lowering reimbursement rates, reducing covered services, procedures, and products. And that's also divesting themselves of a high utilization, chronically sick population that they want to move into original Medicare.
You had a chance to serve on some panels. What were some of the things that happened that you learned with your other members?
So what we found is that with Medicaid in particular, but all of the health insurance industry, that there were stakeholders that were designed to represent all the various groups, whether it's providers, payers, here we are in a hospital, and then we've got the health insurance industry, and then we had state-based officials, government officials, masters in public health, MBAs, masters in public policy, and then we had, of course, naturally a few MDs. What we found is through that stakeholder engagement, there was a constant back and forth and sometimes conflict and sometimes concessions and agreement. But rarely could you get anybody to agree completely on one point, particularly in regards to reimbursement rates, what's a covered procedure, and how much all these co-pays and deductibles and premiums should be.
Pretty sobering to see that it's really just about the biggest lever with the biggest money. Who's got the biggest pocketbook? It's going to be the trade associations, and they're pretty much running the show. You're going to talk to us about the hierarchy with what we see and where you see the healthcare chess game is.
That's right. So in this alliance we've got between deep corporate and deep state. So what we find here on the board is that we've got a hierarchy. Now, the AMA was supposed to be unionized doctors or representing doctors as a stakeholder, but they are pretty much having to succumb to the whims of the government and the health insurance industry. You see.
So who are the pawns on the board?
The pawns would represent the patients, the providers, those who are not represented, for example, by large corporate employer sponsors.
And the mid-level, we got, Rooks you mentioned could be like the hospitals. They do have some pull in all this.
The payers, right. So the payers can have a lot of leverage in terms of they try to offload liabilities in between the payers and the state. If the payer doesn't want to pay something, it shoots it back to the state. If the state doesn't want to reimburse, it lowers the reimbursement rate. Both parties can then show that they saved each other money, or one party showed.
Well, who's the queen in this chess game?
Queen is going to be part of that symbiotic or incestuous relationship and revolving door between the elected officials, the government officials, the MPAs, and the masters in public policy and the masters in public health, who are going back and forth between private sector. So I like to use the analogy where the fox is guarding the henhouse, and you have a revolving door between private industry, particularly the health insurance executives, and state-based officials who will.
So who's the fox in this case? Just so it's very clear.
The fox are the publicly traded MCOs or managed care organizations who convinced everyone to transition away from fee-for-service to managed care.
So the trade associations are running the show. What would be an example of a trade association?
The trade association, for example, would be AHIP, the American Health Insurance Plan Industry, or the American Health Insurance Plan Trade Association. They also have very innocuous sounding names like Coalition to Save.
But broader than that, right, Craig? If we have the farmers and the subsidies they get for making fructose, which also makes things less healthy for everybody, the stabilizer for food, but at the same time keeps people running to the doctor. Maybe not directly related to insurance premiums, but certainly not in the public interest of patients.
Yes.
And then you told us about the revolving door. You go from elected official to trade association. You had a couple examples that you think are coming up.
Right. So we have actually small privately run lobby shops like that being run by Senator Trent Lott and John Breaux when they retired from the Senate. So we've got now retired Senators Trent Lott and John Breaux from the Deep South now representing what you could call deep corporate in an alliance with what people often like to call deep state. But in this context, what's happening is they set up their own private lobby shop for healthcare policy law, and then they aggregate into a larger healthcare lobby firm to get bigger scale, which is Squire Patton Boggs.